Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, September 25th, 2023. Today, we are redropping the birth story of Dr. Stephanie Melka. This is our third straight Melka podcast, or what I am calling our back-to-back-to-back Melkapalooza. For those of you celebrating Yom Kippur, there's a good chance you are not listening to this podcast as, like me, you are in services right now feeling hungry, thirsty, and tired. But I hope that sometime after your break fast tonight, you get a chance to tune in and hear this awesome birth story. All right, reminder, if you're listening on Apple or Spotify, please do rate this podcast, preferably 5 stars. Please leave comments. Also, another reminder, please email us any questions you may have for our mailbag. You can email us at hw@healthfulwoman.com or go to our website, www.healthfulwoman.com, and click on the link that says send us your questions. Also, if you want to pre-order the awesome book Emily Oster and I wrote called The Unexpected, we have a link on our website. You can take a look and you can order copies for you and all of your friends. All right, thanks for listening. See y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Dr. Stephanie Melka, glad to have you here.
Thanks for having me.
Wonderful. So as many of our listeners know, Melka is a regular on the Healthful Woman podcast. But Melka, you got a great birth story.
Yes.
So I thought it would be amazing to have you on for that part of your life as well. And so we could talk about that.
Yes.
Let's start from the beginning. So just set us up. Where were you in life? What was going on, in terms of when you got pregnant?
I married my husband, Giles. We were living in White Plains at the time and
Hi, Giles.
obviously working with the practice.
Does he listen to these?
I don't think so. What? He'll probably listen to this one.
All right, Giles, she's doing great.
He's working from home now. Like anyone that was listening to podcasts has lost their commuting time,
That's a good
which
point.
was their podcast time.
Yeah. Okay. Hello, Giles. Hello, Allison.
Hi, Giles. I guess I got pregnant July of 2017 and then delivered in March of 2018.
Okay. And at the time you got pregnant, so you were obviously working as an OBGYN in our practice. How long had you been there at that time? I know the answer to that, but our listeners might not.
I started with the group in 2012.
Okay, so it's 5 years.
Yes.
All right. And did you have any thoughts or concerns about, the timing of getting pregnant in regard to your career, in terms of your practice? Was that something you thought about a lot or just sort of, whatever?
Not that much. I mean, I graduated residency in 2012 and was single at the time and was never like, I need to find someone and start a family. Like it just sort of happened over time.
Okay. All right. And I think one of the interesting things about pregnancy for someone who is an OBGYN is this, you're in the world already.
Yes.
And decisions you make are going to be very interesting. Like, for example, how do you decide who your own doctor was going to be?
I needed someone that I would listen to, not someone that was like my friend or my colleague or someone that was junior to me, obviously I work with a lot of people that I trust and respect, but like I needed to truly be the patient.
You mean for your own sake, because you just know your own personality.
And for Giles' sake.
I mean, because he could say, listen to your doctor and not.
Early on when he and I were dating, I forget what happened. I think I had a cold or something and it wasn't going away. And I was like, I'll just write myself for a Z-Pak. And he's like, you can't do that. You have to see a doctor. I'm like, oh, honey, let's talk.
Like, I am a doctor.
So, right. And then we were doing this. He's like, can you not be your own doctor? Like, can your doctor not be like you or one of your friends? And I was like, fair enough.
Right. And that's sort of like a general concept in medicine, this idea, number one, you're not supposed to really like, quote unquote, treat your family members. And some of that's just because there's not a conflict of interest, but it's hard to think sometimes rationally, and it's hard to think sort of, you want to be detached from the situation in a sense. For OBGYN people, frequently ask me, like, did you deliver your own kids? I'm like, no, I did not. And first of all, I didn't want to. My wife certainly didn't want me to. But also it's like, what if you're there at delivery and things are going wrong. It's too emotional. It's not just a kid. It's my kid, right? It's not just, a woman, it's my wife. And so it's very hard to sort of be in that situation. And so, okay, treating yourself is, I think people just think you're just going to make bad decisions. You're not going to do the right test. Like, I don't want to do that. It seems hard or this. And
I would either not do anything or do way too much.
Yeah. And then for picking an obstetrician, so you said, okay, you want someone who is, you're going to respect, you're going to trust, who's maybe more senior to you. But how about deciding whether it should be someone that you knew, like, I know this person already, versus going somewhere totally different, like to a different hospital and just like throwing yourself into that practice?
I knew that I wanted to stay at Sinai because I think since I trained there and have only worked there, I feel like I trust people there on a different level than somewhere else. If you're going to a new place entirely, you do get sort of the anonymity where you're just kind of walking in and you're any old person, as opposed to now when it's someone you're like, oh, so-and-so is here.
Right.
But I kind of wanted that familiarity. And it kind of helps if you have to call in a favor or two from time to time to like know somebody.
Right. Like, hey, can you give me a better room? Did you have any concerns about privacy, for example, that so many people who you know are now going to know your business? Whatever. I mean, if there is business,
I didn't, because having taken care of people in the Sinai system, nurses, residents, other OBs, like we don't talk about that stuff with each other.
Right.
If I had someone in labor, nobody's like sitting there opening their chart, reading all their history. Like we're still professional about it.
I agree. It tends to be a greater fear of a problem than an actual problem. I think that really, we know the people we work with, but everyone knows like what's appropriate, what's inappropriate, and where the lines are drawn. And so on the one hand, if I see someone who I know who's there in labor or their partner's there in labor or whatever it is, it's nice that I know them. I can say hello to them, but I'm not going to know their business. I'm not going to know what's actually going on unless they want me to know, because I'm taking care of them. And as you said, there is something nice about having a familiar group of people taking care of you. It takes away some of the fear sometimes that can come about. Okay, so you pick your obstetrician and you're going along in pregnancy. And how was that for you, just in general?
It was weird.
In what way?
Because it's all the things that I would talk about with patients, but never experienced. And now I was experiencing it. And now I was like, oh, now I get it.
So anything in particular that really hit you in terms of an experience?
Really bad fatigue early on. In terms of like,
we thought you were just lazy.
Yeah. And I you know what? True story. I am lazy. I just lie and pretend it was fatigue.
Actually, I apologize. My wife tells me that we're not supposed to use the term lazy. She doesn't use it about children. Unmotivated is the right word. So we just thought
I was lazy.
Yeah, we thought you were unmotivated. That's rough. And listen, it's many people have difficult jobs in various fields of whatever. Being an OBGYN is a hard job physically. You're talking staying up nights, you miss meals, you're working long hours. It's hard. It's hard to do when you're pregnant. It's hard to do first trimester. Do you have a lot of nausea and vomiting?
Yes. Which, if you know me, I'm motivated by food. And it was very weird. Again, in pregnancy, you normally talk about like morning sickness and first trimester nausea. And for me, it was always evening and nighttime, to the point where like Giles almost got worried that I would get home from work and not eat anything. And I had to like connect him, I think.
Right. He knew you were pregnant, right?
He did. Yeah. Yes. I had to connect him, I think, with Jamie Miller to be like, dude, she's eating like a breakfast sandwich every day and a full lunch. Like she's getting in enough food, just she's not eating a dinner. Let it go.
Yeah. And then you also, I remember you had a ton of heartburn.
Oh my God, it was miserable.
Yeah. That's not good for someone who likes
Poor
to eat.
Poor Giles really on Friday night liked getting home and making pizza and had to stop it. Or he could, and I just couldn't eat it, and it wasn't the same anymore.
So I'm curious, what did you do in terms of just those sort of not run of the mill, but common symptoms that women get in pregnancy and you're having them? Did you even talk to your OB about it? You're just like, all right, I know this and I'm going to deal with this myself. I'm so curious about these things.
I did, with the nausea, I was like, I need to start diclegis. Okay. Now I'm maxed out on diclegis. I think I called Meredith Scher and I was like, I need to take something else. And she's like, so let me tell you about, I'm like, I know, just give me Reglan, please.
Right. I should have had her on at the same time because it's also hard as an OB
yes.
to take care of it, to take care of an OB. Because on the one hand, you want to be like, I want to treat this person like I treat everybody else. I don't want to like give, less than standard prenatal care. I want to tell her, but on the other hand, you're like, but she knows this.
Yes.
What am I doing? What am I doing here? When we were having our kids, it was similar, but I wasn't done with my training, meaning I had my kids really young. So our twins were born when I was in medical school. So I don't know anything. Obviously, I'm a medical student. I knew nothing from nothing. And then our third were born when I was a resident. So you knew a lot, but you're still not done. And then our fourth is when I was a fellow. So I definitely knew what was going on, but it wasn't the same thing because I wasn't really taking care of patients in the same way. So I never really had, first, I wasn't pregnant myself, obviously, but I never had the same sort of experience that you did about being like in practice, taking care of patients at the same time that you are a patient yourself. Did your patients know that you were pregnant, or at what point did they know? Obviously, at some point they figured it out.
I didn't tell a lot of people early on. I think there were a few early on that came in with like a due date a month after me that were like, oh, you can deliver my baby again. That I had to quietly be like, well, I might not be able to.
You can deliver mine.
And then I think on Halloween, I wore one of the maternity shirts with like the picture on the baby bump. And if you ever watched Ninja Turtles, it had a picture of Krang on it with a little pacifier in his mouth. And that's when people were like, oh, oh, okay.
That's why you're so unmotivated. Yeah.
Yes.
I get it. All right. And did you find that once it was, out in the open, that it was a bonding thing with patients, that you would talk about it, or was it just something you kept separate? How did that work?
I never brought it up. Some patients did ask. Some had almost like no filter, like patients I've known for years. Like there's no boundaries. They're like, oh my God, what is it like for you? Who are you seeing?
Right.
Are they delivering you here? Or where are you going? Do you have bad heartburn? Do you have this? Do you have that? And then others just didn't ask or say anything.
Even though they obviously knew what was going on. And then I'm also curious, as an OB, obviously there's a lot of really like fun, cool things. If, you're the same gestational age as somebody else or this, that, but we see a lot of bad things happen.
Yeah.
And I'm curious, number one, how did that feel yourself in terms, did it trigger anything yourself? Like, oh my God, like now I'm worried that this could happen to me. That's the first aspect. And the second aspect, did you have this sense like, oh, I'm going to come in pregnant and it's going to trigger her because here I am with a healthy pregnancy and she's not. How did you deal with those?
I can think of two patients in particular right around when I was like 22 weeks where it was obvious that they had not good outcomes in the second trimester. And they felt bad for me. Like I remember being in the operating room, like holding their hand, and they were like, I'm sorry you have to deal with this while you're pregnant.
Wow.
And I'm like, that's so kind of you.
That's amazing, actually.
It really was.
That someone could have that thought process while undergoing such a horrible situation to think about you. That's impressive.
They've both gone on to have children. I delivered one of them, and it sort of like became a bonding thing in like a kind of a different way.
That's really nice.
Yeah.
That I don't want to say I'm floored because I know how amazing our patients are and how amazing people are.
It was the opposite of what I was expecting. I was expecting them to have that, not anger, but that like, well, oh, you're pregnant and I can't believe now I have to like see you being pregnant, taking care of me. And it was the opposite.
I remember we had a similar situation, not the exact same situation, where we had a patient who really horrible outcome happened to the mother, and the husband came and visited us, and he said, I really feel bad for all of you. Like, how are you guys doing? And it's amazing that people think that way and feel that way. And it's more common than people think. And I think it's also this relationship that patients and doctors build with each other, particularly over the course of a pregnancy, because it's not a one-time thing. You're seeing someone for a year straight, and they're coming in every month, every week. And there's a real back and forth bond that develops. We have empathy for them, they have empathy for us, and it's a real relationship. And I think that's really interesting. Wow. So, okay. And so your pregnancy is going along. And one more thing. You went backpacking like in the middle of nowhere, right?
So for my first visit, Giles came. He was like doing the dad thing. Okay, I'll come along. And then we sit down in the office with Meredith Shar and we're going over stuff. And I think Giles is like, she's eating a lot of junk food. And
She Meredith or she you?
Me. And I'm like,
why is Meredith eating so
I'm
much
eating
junk
normal
food?
food. I'm like, I have chips from time to time. And Meredith's like, okay, well-balanced diet. You can have chips. Like, Giles, leave her alone. And then I was like, so I like to run, and I signed up for the Marine Corps Marathon in October when I'll be 20 weeks. And she's like, what the F is wrong with you?
Smoke coming out
You
of her
are not.
ears.
You are. I'm like, but I have friends that have done it. And she's like, and what's your level of exercise been like the last couple weeks? I'm like, nothing. And she's like, just stop. I know it's bragging rights. I know you want to do it, but no. And I was like, okay, fine. And then Giles was like, I like this doctor. And then he never came to a visit again. He came to sonograms, but he's like, I know you're going to listen to your doctors.
I know Giles, he's thinking, this is the first person I've ever met who she listens to.
Yes, not even him.
Yeah, he's like, wow, this is an amazing person to have in my life.
And then I was like, so we have this trip planned in August to go backpacking in Canada. And I think she might have thought I was talking about camping. I've still never really asked her, and I don't want to upset her anymore. But yeah, we had booked this trip with a friend of ours to go backpacking in Canada. We did 2 3-day trips in Yoho and Jasper. And we had booked it not knowing what was going to happen. And then we were like, oh, it's 10 weeks. Okay. And I'm like, well, I feel okay enough. They were short trips, so wasn't carrying that much stuff. And yeah.
But weren't you only reachable by like satellite phone or something?
Correct. It wasn't like our Alaska trip where we were like really in the wilderness. Like you could get out of the woods in a couple miles if you had to. And I was like, I'm 10 weeks. I'm probably fine. But it would be fun. Like wake up in the morning, like filter water, take my Reglan and Bongesta and prenatal vitamin and baby aspirin for the day.
It's so funny that you mentioned that, because when Michal was pregnant with the twins, we had a trip planned to Alaska, and we went. So we went to Alaska, and we went into Denali. And again, this was pre any phone. I mean, we were 7 hours from the closest like payphone, and we went and we came back. And at the time we went, she was like, I don't remember exactly, somewhere 20 to 24 weeks right there. And we get back, and at the next prenatal visit, we're there, and it's, she's with Charlie Bacall, and we're telling him we went to Alaska. He's like, what? And we're like, yeah. He said, what? Where'd you go? We're like, Alaska. He's like, what the hell's wrong with you guys? He's like, there's no way you should have done that. And he's like, don't you know any better? I said, I'm a medical student. I don't know anything. I was like, I know nothing. I was like, was that a problem? He's like, huge problem. What if something happened? I was like, oh yeah, what if something happened? He's like, where were you gone? What have you done? I was like, I have no idea. That's a good
question.
Point. I was like, yeah, good point. All right, lesson 1. And so it was, oh, he was so mad. That's a good thing. That's one of those things, better to ask for forgiveness than ask for permission.
Yes.
But it wasn't like we said, oh, we can't ask him. We had no idea. We didn't think it was a problem. Well, yeah, it's fine. It's all good. Pregnancy's going sort of, moving along. And then you exploded.
Yes.
So let's talk about that. So what happened that really made it a lot of fun?
So it was 33 weeks. I was on call because of course I'm crazy and insisted on continuing to take call and work.
Yeah. Thank God for you doing that. Yeah.
Look, it's a real thing. You don't want to be, oh, I'm pregnant, I can't work, because then other people have to work more. And I wasn't doing anything unsafe.
Right.
It was just not as fun. So, for a couple of days I was like kind of feeling off, but it was the usual stuff, like not great appetite, like eating a little bit less than it would pick up. And that day I didn't eat breakfast. I had a big lunch. You and I had a section in the morning. Then I delivered someone. Then I had a nullip that was fully, and I pushed with her for an hour. And I remember like, oh, let me sit down while I'm pushing. It's just more comfortable. And I pull in a little stool and deliver, and everything goes fine. And then I start getting like right lower quadrant pain as I'm like doing her paperwork. And in my mind, I'm like, I got to finish this delivery summary. I got to finish the birth certificate.
Right. I can't leave this for Fox. I'll be so pissed off.
And then I leave, TMI, go to the bathroom, like absolutely puke my brains out. And I think, oh, I must have eaten something bad. I have a little bit of a stomach bug. And then I go back to do more paperwork. I'm like, nope, back to the bathroom. And then I go upstairs to the call room and I lay down. And now I'm in like kind of severe pain. And I'm like, what the F is going on? And again, it's like severe right abdominal pain.
Right. And it's at night now, right?
Night, yes.
Yeah.
It's probably like 9 o'clock at night now.
Mhm.
And I call you because you're my backup. And I'm like,
because I'm your wingman.
yes, you are my wingman. I'm glad you finally got it right.
Because I'm your wingman.
And I remember saying, I'm in a lot of pain. I need you to come in. And you were like, what do you think's going on? What are you going to do? I'm like, I don't know. I'm going to page my doctors and go check in downstairs. And I page, and I think Meredith was on, and I'm like, I don't know what's going on. And I think she's like trying to do the doctor thing and ask me questions. And I'm like, no, I don't have anything else. I'm just in pain. I'm going to the labor floor. And she's like, okay. And then like I go downstairs and I have this sense to like ask Dave Lubell to watch our tracing of our induction or something. Meredith has now called the labor floor. Diana, the charge nurse, thinks this is a joke. Because again, I was just there all day, did a delivery, everything was fine. And they're like, Melka's coming in a ton of pain. And they're like, no, she's not. She's fine. She's like right over there. Yeah. They bring me in the room. I need 3 narcotics to finally get my pain under control. I called Giles. I'm like, I'm in a lot of pain. I don't know what's going on. You should get here. And he's all flustered. He comes in. We do a sonogram, and I've got hydronephrosis. The tube connecting my kidney to my bladder is enlarged. So we're all like, great, a kidney stone. So we call urology, go back on the floor. And again, you and Meredith and Giles are all in the room. I was
technically your MFM consultant at the time.
Yes.
Meredith's like, because we work with Meredith in her practice all the time. She's like, are you able to do a consultation on Melka? I was like, yeah.
You're like, done.
You bet I can. All right.
And I remember sitting there and like watching the wheels turning in everyone's head, because I've gotten morphine. I've gotten IV morphine, IV Dilaudid, and then IV fentanyl.
Right.
God bless Ben Torrey for being on call that night and being a saint in coming in and like getting me somewhat comfortable.
The anesthesiologist.
Yes.
Right. And and I can definitely testify to the fact that it did not knock you out, because you were quite potty mouth.
Yes.
Drop if you ever dropping, it was an R-rated triage visit, dropping F-bombs left and right. That's how much pain Melka was in.
Yes.
It was pretty gruesome. I mean, to see someone in that much pain. And also, first of all, I know that you're not a complainer, right? Yes. So like, you're not going to be complaining about pain unless you're in terrible pain. Number one, you would never, call me in, call Giles, call your doctor unless you thought like, I'm going to die. Like I'm in really, really terrible pain. And you can just tell you're writhing. It's just horrible. Yeah. And so yeah, it's and that's a tough spot to be in.
In my mind, by the way, I did censor myself once because I was about to say something. I'm like, I can't say that in front of Fox. That will offend him. Like that's too dirty of a curse word for him.
I wouldn't even know what it meant. I don't know. I'm too innocent. You're at a different. You have like a PhD in this, and I'm like at a.
I know. I have to teach you
at a high school level. I don't know anything, so I'm. Yeshiva education did not teach me enough, in this regard. It's hard. So I'm just trying.
At some point, I don't know if we're going to delete this out or not, but
no way.
They figure it's a kidney stone, and Meredith's like, great, call urology. Brittany Roser, the resident who was an intern at the time, pages this resident at home, gets her to come in. And the resident comes in and is like, oh, we see this all the time in pregnancy. And I remember you and Meredith looking at each other. Giles looking confused, and I think I was like, F off, no we don't, or something like that.
Like we might see this a lot, but not like this. Yeah,
I was like, no.
Like,
no.
Wrong. Next. Next answer, please. I'm trying to, tell me what, aside from being, partially stoned and all the medication they gave you, what are you thinking? Is it pain? Is it fear? Is it like irritation that this is going to like lay you up for a long time? Like what exactly is swirling through your head at this time? Because you know more than than you should.
When I first got into room 24, I remember in my mind I was still like analytical about it and not scared, but I was like, I don't know what this is. Like It's not my appendix because I'm not throwing up more and it came on so quick. It doesn't seem like preterm labor. am I abrupting? Like,
Right.
but I'm not bleeding. Maybe this is what an abruption feels like. And in my mind, I'm like, and it's not my kidney because I don't have back pain. Because
Right.
typically when it's a kidney stone or a kidney infection, it's always back pain.
Right.
And I think even when I was in the call room upstairs, I was like hitting my back. I was like, are my kidneys okay? So I had gone through all that and I was like, what is going on? And then when I finally got in the bed and got meds, I was just like, I'm done. Like, you guys are here. You can figure it out.
Yeah, just keep the fentanyl coming, and I'm gonna outsource the
and it was just
the thinking to you guys.
Yes, it was just an unbelievable level of pain.
Yeah.
I can't even explain it. And then I think I was getting more comfortable and I was falling asleep. And then I would wake up and like curse again. And I think I remember Meredith being like, well, you seem a little bit better. And in my mind, I was like, I think I'm just snowed. Like,
listen, obviously it was very clear to anyone around that you're in a ton of pain. And it's sort of the same thing. And we're thinking the same things. Well, what is this? Is it this? And we're going through the same things you're going to be going through until your brain wasn't working anymore. But at a certain point, you do have to just relinquish this and say, all right, it's not me. I'm just going to like try to sleep here and let these people figure out what's going on. Was that something that you were concerned about? Or you just like, I trust these people.
No,
I'm done.
I had zero concern.
Yeah.
I mean,
some people have a very difficult time with that, even if they're not doctors. Some people just cannot give up that control over the situation to others. It's hard.
And I remember like that all kind of going through my mind and thinking like, this is what it's like for patients. Like, this is really freaking scary. Like, imagine if I had no idea what was going on.
Right.
And like, I can remember like, Diana again came in the room, put in my IV, like drew bloods, like the resident came in and like ordered whatever needed to be ordered. And I remember just thinking like, I'm so happy everyone's here.
Right. It's interesting because as doctors, we sometimes forget that, because I don't mean as the patients, like as the doctors, we sort of start thinking immediately like, okay, is it a kidney stone? Is it appendicitis? And we start going through in our heads and we're sort of like rapidly trying to process this, what is happening and what do I need to do? But on the patient's end, most of them don't have that level of knowledge that you have. And so sometimes all it takes is for one of us to say to the patients, like, you're not going to die. Like, you're going to be okay. We'll take care of you. And your baby's going to be okay. Like, I don't know what this is, but I know what it's not. And you are both going to be okay. And we sometimes forget to even tell them that. And we just start going through it. Was it this? Is it this? Is this? And they're thinking not, what do I have? But is my baby going to live? Am I going to be okay? And it's one of these things on our end to really, we have to go back to the basics. Like, what are people actually thinking about in that situation? And most of them are not poking their back to see if it's a kidney stone, versus an abruption. They're like, am I going to die? Because it's such a horrible place to be.
Yeah.
And that's on us to remember to do that, to reassure people. Okay. So you're in the hospital, and ultimately, right, we made what was the diagnosis?
So the next day
listeners?
I get a CAT scan because they're like, okay, it's a stone. Let's get a CAT scan. Let's see what it looks like. And on CAT scan, there's no kidney stone. There's now fluid around my kidney. So we like to say my kidney exploded.
Kaboom.
And it was basically my uterus compressing my ureter, which was preventing the kidney from draining fluid. I don't know if I ever told you this. While I was in radiology, as I was going down, I texted a patient of ours that I delivered who was a radiology resident at the time. And I was like, hey, I'm pregnant. I think I have a kidney stone. I'm getting a CAT scan. Are you around? And she came over and is like, what the hell is going on? And then I get the CAT scan and she comes over to me and is like, hey, the attending's reading your films now. Do you want to see it? So I'm like, sure. So I've now got the IV pole, the hospital gown, walking into the radiology reading room. And I go, hey, there's a baby in there. And they all just look at me. And I'm like, I don't know. I thought that was the funniest joke in the world. And I'm like, where's the stone? And they're like, there's no stone. I'm like, what do you mean?
Yeah, your kidney exploded, ma'am.
Yes.
Someone put a grenade inside your kidney. So on the one hand, when the diagnosis is made, was that a relief to you that at least you know what it is? Or was it scary or just like cool?
Just whatever.
Yeah.
It's just like a name to this thing. And okay, now what?
Yeah, that's the thing. And we always talk about like your biggest risk factors being an OB. Like, of course, something crazy is going to happen to you. I mean, we see this complication, definitely less than once a year. So it's less than once in 1,000. Yeah. And of course, you have it. So then, and ultimately, what did you need at that point?
So I needed a nephrostomy. So then the urologist, Neil Grafstein, who was wonderful,
right,
comes in. Giles is there. And he's like, all right.
Right. And you know Neil.
Yeah, I mean, I had worked with him as a resident,
Yeah.
like, so I knew of him peripherally, and I'm
Yeah.
like, oh yeah, I did a case with him when I was a chief. He's great. Okay,
Yeah.
whatever.
He's a good dude.
Yeah,
Yeah.
he was wonderful. He's like, so we could do a stent, and put a little tube in the ureter, and it's going to cause some discomfort, and you're probably going to have spasms and need to be on pain medication, but it's there. Or we can, basically put a tube through your side and drain your kidney into a little pee bag for a couple weeks, and you're going to be fine. People tolerate it really well, but you have a pee bag out of your side. And I was like, sign me up for the stent. And he's like, well, he's like, look, I'll do either, but you really should, whatever. And then he's like, talk about it. And he leaves the room, and Giles looks at me and is like, you remember when we said that you were going to listen to your doctors? And I was like, oh, fine.
So for our listeners, assuming everything is well, we have 2 kidneys, one on our right, one on our left. They're sort of in our back. And what was proposed to Melka is they're going to basically take her to the radiology suite, give her some, numbing medicine, but basically poke a tube through the skin in her back, through her back, into her kidney,
yes.
Leave it in there, and then basically attaching a little hose to that thing to drain into a bag that is strapped to her leg, essentially for the next, 2 months or so. And so your right kidney is draining into a bag.
Yes.
And your left kidney is still working. So you still do pee
Correct.
also.
Yes.
Right. So you get double whammy there.
Yes.
And that's just going to be there. And that was the plan.
Yes.
And so how did that go?
It went really well. Friday that they scheduled the case for, Rocco, who's my anesthesia friend, who's been like a good friend since med school, and
It's
like
her birthday today, isn't it?
It is.
Yeah. Happy birthday, Rocco. We love you.
She's like my personal anesthesiologist.
Right.
She's doing the procedure, and when she's talking to me about it, this is like the fentanyl haze I was in.
Mm-hmm.
I was like, you should have one of the OB anesthesia fellows join you, because they need cases that aren't deliveries. And because I had that conversation with Balin and Zahn 2 weeks ago, and I'm like, why is my mind going to this stuff? We go to IR, and again, it was the same thing. Like, the fellow came and is like, so I have to talk to you about the risks and benefits. And I'm like, you know what? I don't know that much about this.
Right.
Go for it.
Right. Pretend I know nothing. Yeah. Pretend I know nothing.
Yeah.
Yeah.
So I'm in IR and
interventional radiology.
And yes.
Yeah. That's the radiology suite. Okay.
So basically they do a CAT scan again and look, and they give me, I think, IV Versed.
Right.
Something where I'm just happy and sleepy.
Right.
And then they numb the skin. It's bottom of my rib cage on the right side.
Yeah. On the back. Yeah.
Yes. And then while they're doing x-ray, basically jab in a giant needle and then put a little tube in, and then pull out the needle, and the tube stays.
Right. It's almost like an IV, but instead of going into a vein, it's going into a kidney. Yeah.
Yes.
But conceptually, it's the same thing we do for a lot of things, but it has to be, make sure you're getting the right spot.
Yes.
Okay.
So then I'm there thinking when we talked, it was fluoroscopy. So it's the fancy radiology stuff. I'm like, this is the real deal, radiation that you tell people if you had to get it once or twice in a pregnancy, it's probably fine. And I'm like, and of course I'm laying here right now.
Right.
What the hell?
Yeah, no, the fear with fluoroscopy, it's a lot of, it's live x-raying. And so there's more radiation exposure to the fetus. Generally, it can be done in a way that's safe, particularly if it's in your kidney in this. But yeah, it's something to talk about. You wouldn't do it, for no reason whatsoever. Right. But the alternative is really, there is no alternative. I mean, because we could deliver the baby at 33 weeks and that would relieve your kidney, but then you have a preterm child and there's, risk to that too. And so it's tough. I mean, we were speaking about this, and it's a hard situation. Then afterwards, for your recovery, that was an interesting thing about whether you go to work or not. Yeah. And I remember you eventually had to just give up.
So the procedure went fine. I went back upstairs, and it was amazing. I got off fentanyl right away. That area was a little bit sore, but I was like, this is great. Okay. Yeah. And then the next day, I think it was Meredith on call again, and is like, you're taking off work next week. And I was like, I don't want to. And she's like, stop it.
I want to go to work. It was a Thursday night when you were on call initially, I think.
Wednesday night. Yeah.
Right.
Because I used to do Wednesdays, and then procedure was Friday, and I went home Saturday.
Yeah. Okay.
It was actually Bender as the voice of reason. That is you have a tube going into one of your organs. You are not setting foot in the hospital. in getting MRSA or God knows what
Yeah.
until you're ready to deliver. And I was like, but, and he's like, stop it.
Right. Enough.
Yes, pretty much.
Enough, young Melka.
Yes.
Yeah.
And again, I was like, all right, fine. I know.
Yeah. Now, America's, we had that conversation and you're like, listen, I just, Meredith doesn't, I was like, it's not Meredith. It's just don't work. Like, what do you out here? I was like, what are you? Yeah.
Yes, I am out of my mind. You know this.
Right. It's a good point. Or you're in your mind, but your mind is off.
Yeah.
Eventually you after, was it like 3 weeks or something? You were in the office, you would, see some patients.
I went back to the office. I think I worked like 8 to 3 or something.
Yeah.
So that way I could drive in and out without like a ton of traffic. And,
right.
Because I also told Meredith, I was like, I'm not staying home. Like, I feel fine. What am I going to do? Like sit at home and do nothing for 7 weeks now? Right. So yeah, I just sat in the office and I would see patients.
Did the patients know that this had happened to you? Like, could they see your
They
bag?
couldn't. So the beautiful thing about maternity clothes, because they have that like big elastic thing that goes all the way up, you could just tuck the bag in the side and it would just sit there and never knew.
Wow.
There were a few patients that I told because like I was supposed to have delivered them and then we had to cancel. I think you ended up delivering one and she was like worried about me. And then she's like, are you okay? And I was like,
why aren't you worried about me? I'm delivering you now instead of Melka. I could be home with my family. You're worrying about the wrong person. She's at home having a Pepsi.
Yeah.
No. We worry about Melka.
Of course.
What was it like shifting from sort of a pregnant patient to quote unquote, like now you're a high risk patient, all this stuff going on, you're people worrying about you, you're seeing all these specialists. Was it just like whatever?
Throw my hands up in the air. And I was like, whatever.
You're like, of course, this is going to happen to me.
Yeah. And then like, I think when I was seeing Grafstein and he's like trying to figure out like, when do we take it out? What imaging do we do? And he was like asking me something. I'm like, whatever you want. I don't care.
I give up.
I think he like felt bad and wanted to try to take it out sooner. But what if it wasn't ready? I'm like, I appreciate it, but I don't care.
Yeah.
Whatever you want.
Yeah. Whatever's best. And then at what point did you deliver?
40 plus weeks.
Wow, you went all the way to your due date.
I did, which was also funny because I remember some of you guys, I think Rip Barber was like, I would just deliver you at 37 weeks. Like, you have a tube. And you were like, no, why? You could wait.
Yeah.
I had asked early on, like, could I just have a scheduled section? Like, and they were like, yeah, we would. But then by that point, I'm like, yeah, let me just not do that.
Right. No, I mean, it's one of these things where there isn't a right or wrong answer. It's, you can get delivered a little bit earlier and it's probably fine for the baby and it's probably fine for you, but there's a little bit risk going earlier and you can wait longer and it's probably fine for you and probably fine for the baby, but there's a little risk on that end too. And ultimately you were doing really well and you wanted, it did increase your chance probably of a vaginal delivery waiting a little bit longer.
Yeah.
And it worked out.
I will
in
say,
retrospect, it was the right decision.
Yes. When I was admitted, one of my friends at Sinai had texted me and said, I'm really sorry. I noticed your name on Epic. Is everything okay? Can I do anything? And I was like, oh boy, let me tell you what's going on. And apparently when the residents signed out each morning, they never said it was me. So like half of the labor floor didn't know it was me on Thursday until I'm like getting wheeled through on the stretcher going down for CAT scan. Everyone's like, what the hell?
Right. You're
Wait,
just,
you're the one in 24?
Right. You're just SM 33 weeks with right pain.
Yes. So actually it really did speak to people, like, honoring my privacy and not like, talking or anything.
Right. And then how'd the labor and the delivery go?
Oh God. Very long induction. Induction started at midnight and then I delivered 27 hours later by forceps after pushing for an hour and a half, which when somebody asks, can I have a scheduled C-section? They will always end up with a long labor and long pushing and forceps.
Right. But it is poetic that you were delivered by forceps because it's one of the things you do yourself, and so bring it. Yeah. Okay, but that's great.
And again, like in labor, I was just like, okay, whatever.
Right.
Towards the end, I was like, how low is the head? And I think Michelle Silverstein, who delivered me, like kind of knew what I was getting at, and she's like, it's almost low enough if I had to. I was like, okay, good. That's all I need to know.
That's great. And so tell us about your baby.
So Allison she'll be 3 in March. So I don't know when this episode is going to air, but
probably March.
Great.
She is, like you, a loquacious young lady.
Yes. Getting ready for delivery, one of the things we've talked about is how are you feeding the baby? Are you breastfeeding or whatever? And
Right.
I, like most people, was like, well, of course I want to breastfeed, but let
Right.
me see what happens. And
Right.
as I was going through all of this and it was just becoming like worse and worse, I was like, now I understand why people really want to breastfeed.
Right.
Like it's something normal
Right.
about an entirely miserable process.
Right. It just sort of brings it back to like, okay, this is how it's supposed to be.
Yes.
In a certain way. And so you deliver forceps, Allison's healthy, everything's good. How long was that sucker in your kidney?
Came out about a week later.
Yeah. And then after that, did you basically feel like normal? I mean, I guess like any
Yes.
postpartum woman would. I mean, your kidney was fine.
Yes.
Yeah.
Yeah. No residual problems. Had a
Mhm.
sonogram a couple months afterwards. I did sleep pretty well when I had it because half of my urine was going in a bag, so I
Yeah.
didn't have to get up and pee every 3 hours overnight,
pretty cool.
which was nice. That was the only good thing about it.
Yeah, you get that's all right. That's a good sell. After the nephrostomy, the fancy term,
Yes.
the kidney tube, after it came out and you're in your postpartum period, number one, what do you think about coming back to work after that point? Because now you've worked while you're pregnant. You sort of like you were really military in that
Yes.
sense, and now you've delivered. Did you feel like I need to come back really soon? Or you're like, I'm just gonna take my time with my daughter. What was your thought process initially?
Take 12 weeks off.
12 weeks.
I was like,
Yeah.
I'm going to do that. It's the most I can take. I'm
Right.
going to do it.
Right.
And then I think around week 10 or 11, I was like, I'm kind of ready to go back. Like, I miss people.
Yeah. Right.
And like, work is part of who I am.
Right.
And I was like, well, it's great, but like a 10-week-old does nothing
Yeah.
but like eat, sleep, and poop.
Yeah.
So
It's yeah. I mean, I know I have friends like that also. But okay, so looking back at this whole experience, I'm curious. The first thing I want to ask you is, you've had this experience yourself as a doctor, as a mother. Complicated pregnancy. Unfortunately, everything went well, but it was certainly quite rocky and more quote unquote exciting than we thought it would be. The fact that you've had a pregnancy and delivery, and B, sort of a more complicated one, how does it affect the way you treat patients now? Does it affect it at all? Do you feel any different about how you treat patients compared to maybe before you got pregnant?
I think it's made me a lot more sympathetic. Like, I think early on I had a little trouble connecting with patients, and now I have something concrete. And I also get why very minor things are very frustrating. Like people who are like, oh, I can't exercise the way I used to, or, oh, I'm not sleeping that much and now I have to sleep more on the weekends. I used to just say like, oh, whatever, that's pregnancy.
Right.
Now I'm like, yeah, that's pregnancy, but I get it. It really sucks.
Do you find that the patients feel the same way? Like they feel a stronger connection because you've been through this? Or is it just a way for you to sort of, reach out to them and connect to them?
Yeah, I think it's just more me reaching out and connecting. I sometimes feel weird if I'm bringing in too much of my own experience because I don't want them to think I'm like taking it over or making it a comparison.
Right.
One thing, for example, is forceps. Like I've done a
Right.
bunch of them in the last couple of months, and after the delivery, I'll always say like, oh, my daughter was born with forceps. Then they'll go, oh, that makes me feel so much better. And I was like, I don't want to say that beforehand because I don't want
Right.
it to seem like it's like,
Right. Because it was fine for me, it'll be
right,
fine for
exactly.
you. Right.
Yeah.
I had this conversation with one of our Health Woman podcasts with Steph Lamb
Mhm.
about, this concept of, as a doctor, is it better to have that personal experience? Is it neutral or is it worse? It's like we never expect our oncologists to have, survived cancer in order to be good oncologists, right? One has nothing to do with the other. And so does having an OB who went through pregnancy, is it better, neutral, or sometimes potentially worse? And I think it really just depends on the attitude. On the one hand, I think there's an advantage because, again, you can have that sort of personal empathy, like, oh, I know what you're going through. I went through that. On the other hand, it's not like you need that in order to empathize.
Yeah.
But I do think that some people take it to a degree where it makes it worse, where, as a patient, you're like, dude, like your pregnancy is not mine. Yeah. Like just because it worked out well for you doesn't mean it worked out well for me, or just because you weren't afraid of something doesn't mean I won't be afraid of something. And like enough about you, it's supposed to be about me. And I think that, again, it's really on us as doctors to be balancing how much we share and sort of try to, connect in that sense versus how much we not stick our business into her pregnancy. And I'm not saying I know what the right balance is, but it's always interesting in that sense. It's mostly unique to, to women OBGYNs. But even for me, like, sometimes we'll talk about my wife's pregnancy. And again, I don't have the same symptoms, but I sort of say, for example, my third was also born forceps. And I do tell people that I say, one of my kids is born forceps. And I think, just to sort of give a sense that I trust them, that I think that they're, safe and they can be done. But I think that is a really interesting aspect about being an OB and then being pregnant during your, during everything. And I'm also curious if you had to go back, right? So now you're 3 years older, you have a 3-year-old daughter, you're 3 years more mature, you're 3 years more senior. Would you have done anything differently yourself, you think, during that pregnancy, either leading up to it or during that, maybe, compared to before?
I don't think so.
Right. You're about the same.
Yeah.
Excellent. Melka, thank you so much for coming on and telling your story.
Thank you for having me.
I know it. I was a part of it, and it's awesome. And I'm sure our listeners will appreciate it. It's always interesting when doctors become patients. On the one hand, having the inside scoop on what's going on is helpful, but it can also make things complicated. Do you see someone you know or someone you don't know? Do you want familiarity or anonymity? For an OB who's pregnant, it's even more magnified, as you know it's going to end in a delivery on the labor floor, which is where all of your colleagues and friends work. Melka's story touches on all of this, and when things got complicated, it ultimately didn't matter and it all worked out, but it was pretty wild at the time. Thanks, Melka, for sharing your story. Thanks for listening. Have a great day. Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.